Among the countless subtle ways vitamin B12 shapes human health, one of the most intriguing and least discussed is its potential link to tinnitus, the persistent ringing, buzzing, or hissing in the ears that afflicts millions worldwide. Tinnitus can devastate quality of life, disrupting concentration, sleep, and emotional well-being. Yet in many cases, the root cause remains a mystery, and treatments are limited to coping strategies rather than cures. Emerging research, however, hints that a silent deficiency in B12 might be an overlooked contributor to this enigmatic condition, offering a potential avenue for relief that deserves far more attention. The auditory system is an exquisitely delicate network that depends on rapid, precisely timed electrical signals traveling along the cochlear nerve and through complex brainstem pathways. The speed and integrity of these signals are maintained by the myelin sheath, an insulating layer that B12 helps synthesize and preserve. When B12 levels drop, demyelination can occur not just in the spinal cord or peripheral nerves, but in the auditory pathways as well. The result can be the generation of erratic or spontaneous nerve impulses, perceived by the brain as phantom sounds, tinnitus. This theory isn't mere speculation. Small clinical studies have documented cases where patients with tinnitus and documented B12 deficiency experienced partial or complete resolution of their ringing after supplementation. In one such study, a significant number of tinnitus sufferers showed low serum B12 levels compared to control subjects, and improvements in tinnitus severity were noted following B12 therapy. While these early findings don't prove causation, they suggest a meaningful association that warrants deeper exploration. The connection becomes even more plausible when considering other symptoms that often accompany tinnitus in B12 deficiency: hearing loss, dizziness, or unsteadiness, signs pointing to broader dysfunction in the auditory and vestibular nerves. Many people with unexplained tinnitus also report fatigue, mood changes, or numbness, which, taken together, form a constellation of B12 deficiency symptoms that are too often treated in isolation rather than as a unified syndrome. What makes this relationship especially compelling is the possibility of reversibility. Unlike age-related hearing loss or structural ear damage, demyelination-driven nerve dysfunction can sometimes improve dramatically when the underlying deficiency is corrected, particularly if caught early. This raises the hopeful prospect that for at least some tinnitus sufferers, something as simple and safe as replenishing B12 could reduce or eliminate their symptoms, transforming their quality of life without resorting to invasive or experimental interventions. Yet the role of B12 in tinnitus remains virtually unknown outside of a few specialized research circles. Routine evaluation of tinnitus rarely includes testing for B12 status, and many clinicians remain unaware of the nutrient's potential involvement. Patients, too, are often left to believe their symptoms are irreversible or purely idiopathic, never suspecting that a nutritional deficit could be contributing to the unrelenting noise in their ears. Recognizing the overlooked link between B12 and tinnitus invites a shift in perspective. Rather than viewing tinnitus purely as an intractable auditory problem, we can see it as a potential warning sign of broader neurological vulnerability, one that might respond to simple, targeted nutritional therapy. For individuals struggling with unexplained tinnitus, assessing B12 levels, especially if they also have risk factors like advanced age, vegetarian diets, gastrointestinal disorders, or long-term acid-suppressing medication use, could offer a pathway not only to quieter days and nights, but to better overall nerve health. Ultimately, this emerging connection highlights a profound truth. Even the most mysterious and disruptive symptoms can sometimes trace back to overlooked fundamentals of nutrition. By broadening awareness of B12's hidden roles, we empower people to seek root cause solutions and remind ourselves that the path to healing is often simpler and more accessible than it first appears.